Important message. If you're living with joint pain, whether it's from arthritis, inflammation, or wear and tear, and you live in the United States, United Kingdom, Canada, or Australia, this script is for you. People are desperate for relief. And the words, natural remedies, are often met with skepticism. But for many Americans, they've become the only way out when pills stop working. Natural doesn't mean weak, it can mean powerful, safe, and effective. The number one thing people report when struggling with joint pain in the United States is not being able to sleep through the night. The pain pulses in their knees, in their hips, in their shoulders, or in the back of their neck, and no matter how expensive their mattress is, they can't get comfortable. Many have been prescribed NSAIDs, ibuprofen, naproxen, or even prescription drugs that come with serious risks to the liver, kidneys, and heart. Others have been pushed into considering joint replacement surgery. Yet millions are now turning to turmeric, one of the oldest natural anti-inflammatories used in both modern integrative medicine and ancient Ayurvedic practices. Turmeric contains curcumin, a compound shown in numerous U.S. clinical trials to reduce inflammation markers, like CRP, C-reactive protein, and IL-6. But not all turmeric is created equal. In the United States, a massive number of turmeric supplements fail to include black pepper extract, which is essential to dramatically increase the bioavailability of curcumin. Without it, your body absorbs less than 5% of the active ingredient. Studies from major institutions in Canada and the United Kingdom have shown that adding piperine from black pepper increases absorption by up to 2,000%. Making a turmeric supplement without it virtually useless. The second natural remedy that deserves real attention is collagen, specifically type 2 collagen, which directly supports joint cartilage. People in their 40s and 50s from the United States who are beginning to feel creaky knees when they climb stairs or stiff fingers when they wake up often don't realize they've lost a significant amount of natural collagen. After the age of 25, collagen production declines by 1% per year, and by the time you're in your 50s, you might have lost over 30%. Collagen is the primary building block of cartilage, the tissue that cushions your joints. A randomized, controlled trial from Canada found that patients who took hydrolyzed type 2 collagen for 24 weeks had reduced joint stiffness, increased mobility, and lower scores on pain rating scales. It's important to note, most cheap collagen supplements in the U.S. market are made from type 1 and 3, which help skin and nails but do almost nothing for joints. The joint-specific type 2 version is harder to find, more expensive, but far more effective when the goal is cartilage repair. Another natural remedy that often surprises people is Boswellia serrata, also known as Indian frankincense. This resin is not just a spiritual incense. It's one of the most studied anti-inflammatory herbs in traditional medicine and has been researched for osteoarthritis and rheumatoid arthritis. In studies conducted both in the United States and India, Boswellia extracts were shown to reduce the enzymes that degrade cartilage, particularly MMP3, matrix metalloproteinase 3. Participants in these trials reported better joint function within just 7 days. People from Australia and the United Kingdom who had previously relied on steroids for inflammatory joint diseases reported being able to taper down or stop steroid use altogether with Boswellia supplementation. What's critical here is standardization. Look for Boswellia with at least 65% boswellic acids, which are the active compounds that deliver the anti-inflammatory benefits. Many products in the U.S. market use raw Boswellia powder, which does not provide the same results and is often diluted with fillers. Omega-3 fatty acids from fish oil is another remedy that continues to be underused despite mountains of clinical evidence. A 2020 double-blind, placebo-controlled trial in the United States found that omega-3 supplementation reduced joint pain in patients with rheumatoid arthritis to the point where many could reduce their reliance on conventional medications. Omega-3s are essential fatty acids that modulate inflammation at the cellular level. They reduce the production of pro-inflammatory cytokines like TNF-alpha and IL-1 beta. For someone in Canada or the United Kingdom suffering from chronic stiffness, in the morning or aching in their hands after a day at work, omega-3s provide lubrication for joints and protect cartilage. The problem is that the typical American or Australian diet is severely lacking in omega-3s and overloaded with omega-6, which trigger inflammation. If you're buying fish oil in the U.S., make sure it's molecularly distilled, high in EPA and DHA, and from wild-caught fish, not farmed sources, which often contain toxins. A good dose is around 2,000 mg per day for joint health. Another increasingly popular remedy is MSM, methylsulfonyl methane. MSM is a sulfur-containing compound that naturally occurs in plants, animals, and humans, and it plays a crucial role in collagen synthesis and inflammation control. People from the United States who've struggled with long-standing joint issues from sports injuries or aging cartilage have reported significantly improved mobility and pain reduction within weeks of taking MSM. In fact, a U.S. clinical trial published in the journal Osteoarthritis and Cartilage, found that 3 grams per day of MSM led to noticeable reductions in pain and improvements in physical function in patients with osteoarthritis of the knee. MSM works synergistically with glucosamine and chondroitin, which are more well-known but often overhyped. When taken alone, glucosamine and chondroitin have limited effects, but in combination with MSM, many people in Australia and Canada have reported much stronger results. MSM also has antioxidant properties, which help protect joints from oxidative stress, something that accelerates joint degeneration in aging populations. Devil's Claw is a lesser-known herbal remedy originally from southern Africa, but widely used in European natural medicine and now gaining popularity in the United States and United Kingdom. The root contains iridoid glycosides, particularly harpagoside, which has been found to reduce joint pain and stiffness. A study from Germany showed that Devil's Claw extract was as effective as a low dose of NSAIDs in relieving back and joint pain. For individuals in Canada and Australia dealing with lower back stiffness or hip pain that radiates into the legs, Devil's Claw offers relief without the gastric side effects of NSAIDs. However, like many herbal remedies, quality is everything. Look for standardized extracts with 50-100 milligrams of harpagoside per dose. Cheap versions sold in U.S. drugstores are often underdosed and mixed with fillers. And it's not just about reducing pain. Devil's Claw has also been shown to improve physical performance in those who suffer from chronic joint conditions, helping people return to walking, biking, or working out with less discomfort. Vitamin D is often discussed for bone health. But what many people across the United States don't know is that vitamin D deficiency has been directly linked to increased joint pain and autoimmune conditions. Studies have shown that low serum vitamin D is common in people with rheumatoid arthritis and other inflammatory joint disorders. Americans, particularly those in the northern states, often have insufficient sun exposure, leading to suboptimal vitamin D levels. Blood levels below 30 ng/ml are considered insufficient, and yet nearly 40% of the U.S. population is under that threshold. People in Canada, with their longer winters and limited sun, face similar issues. Vitamin D modulates immune function and reduces systemic inflammation. Supplementing with 2,000-5,000 IU daily has been shown in U.S. research to reduce joint swelling and tenderness, particularly in women over 50. It's crucial to pair vitamin D3 with vitamin K2 for better calcium utilization and to avoid calcification of arteries. This combination helps protect both your joints and cardiovascular system, especially for those in their 50s and 60s dealing with arthritic conditions and heart health concerns simultaneously. One of the most overlooked natural remedies for joint pain is ginger extract, which is far more than a culinary spice. Inflammation is the key driver of joint deterioration, and ginger works on the same biological pathways as NSAIDs, but without the harmful side effects. US-based studies have shown that ginger inhibits COX-2 enzymes, which are responsible for producing prostaglandins, chemical messengers that trigger pain and swelling in joints. Patients suffering from osteoarthritis who were given concentrated ginger extract twice daily experienced significant reductions in knee pain and improved physical function. Many Americans dealing with pain in their knees, hips, or hands from arthritis describe being skeptical at first, only to report meaningful improvements within just a couple weeks of consistent use. Unlike ibuprofen or naproxen, which can lead to ulcers, kidney strain, or elevated blood pressure with long-term use, ginger is much safer and actually supports digestion and immune health. Canadians who combine ginger extract with turmeric have shown even better responses, with some users reporting less dependency on over-the-counter painkillers. The important factor is the dose. Don't expect results from sipping a little ginger tea. The effective therapeutic dose from clinical studies is 500, 1,000 mg of ginger extract daily, standardized to at least 5% gingerols. Another scientifically supported option that's gaining traction in the United States and United Kingdom is tart cherry extract. Originally popularized among athletes for muscle recovery, it's now widely recommended by U.S. chiropractors and integrative health clinics for managing chronic joint pain and gout. Tart cherries are rich in anthocyanins, which are powerful antioxidants known to reduce oxidative stress and inhibit inflammatory pathways. They've been shown to decrease uric acid levels in gout sufferers, making this extract especially helpful for men over 40 who struggle with painful flare-ups in their toes or ankles. Research from Michigan State University revealed that patients drinking tart cherry juice daily had a 20% reduction in osteoarthritis-related joint pain within a few weeks. Australians who incorporate tart cherry extract before and after workouts report less joint stiffness the following day. The key is consistency and quality. Many tart cherry juices sold in U.S. supermarkets are loaded with added sugars and lack the concentration necessary to achieve therapeutic benefits. Look for supplements or unsweetened juice concentrates with at least 1,200 mg of anthocyanins per dose to support joint recovery, particularly for people engaged in physical labor or regular workouts. Hyaluronic acid is another natural compound found in the synovial fluid of joints, providing lubrication and shock absorption. But as we age, especially for adults in the United States and Canada, our natural production of hyaluronic acid declines, resulting in dry joints, stiffness, and increased friction. What's more, those living in dry or cold climates like parts of Canada or the northern United States may experience worse symptoms due to environmental conditions that exacerbate joint dehydration. Intra-articular injections of hyaluronic acid have been a common treatment for osteoarthritis, especially in the knee, but newer studies show that oral hyaluronic acid supplements, particularly low molecular weight forms, are also effective. A Japanese study found that patients with mild to moderate osteoarthritis saw improvements in joint mobility and pain scores after 8 weeks of oral hyaluronic acid supplementation. American patients who combine this supplement with collagen and MSM often report faster joint recovery and less cracking or grinding in the knees and hips. It's crucial to ensure the supplement is bioavailable. Look for clinical grade, low molecular weight, hyaluronic acid, ideally in a capsule or liquid form, with at least 200 mg per serving. Glucosamine sulfate has been a popular joint health supplement for years, but its reputation has been mixed because not all forms are equally effective. People in the United States have been sold glucosamine hydrochloride in cheaper formulas that fail to produce meaningful results. However, multiple long-term studies have demonstrated that glucosamine sulfate, not hydrochloride, is capable of slowing joint space narrowing, especially in osteoarthritis of the knee. A 3-year study published in the journal Arthritis and Rheumatism found that glucosamine sulfate slowed the progression of joint deterioration compared to placebo. This is critical because joint space narrowing means the cartilage is being lost, bones are grinding together, and joint replacement may become necessary. Americans facing this situation should make sure they are buying the sulfate form, ideally at 1,500 mg daily, possibly split into 2 doses. In the United Kingdom, it's often prescribed in combination with chondroitin sulfate, another cartilage-supporting compound, to enhance joint protection and reduce inflammation. This combination may take 4 to 8 weeks to show benefits, but many patients report reduced morning stiffness, easier movement, and improved quality of life over time. Another very powerful but often misunderstood joint remedy is EGCG, the main catechin found in green tea. EGCG has profound anti-inflammatory properties and is a strong scavenger of free radicals that damage joint tissue. In both American and Canadian studies, EGCG has been shown to inhibit the expression of several pro-inflammatory molecules such as NF-κB, IL-6, and TNF-alpha. These are the same inflammatory markers elevated in people with rheumatoid arthritis and other autoimmune joint disorders. In fact, a study from Case Western Reserve University in Ohio demonstrated that EGCG significantly suppressed the development of arthritis in mice and reduced inflammation in human joint cells in vitro. People from the United States who struggle with autoimmune joint pain describe feeling powerless because pain medications don't treat the root cause. Incorporating high EGCG green tea extract into their daily routine has given some a non-drug option to reduce systemic inflammation, but tea alone won't provide the therapeutic dose. You need a concentrated extract with 300–500 milliliters of EGCG per serving, and preferably decaffeinated if you're sensitive to stimulants. It's especially beneficial when combined with other anti-inflammatory agents like turmeric or ginger. Ashwagandha, a powerful adaptogenic herb traditionally used in Ayurvedic medicine, is becoming increasingly recognized in the United States and Australia for its role in reducing stress-related inflammation. Chronic stress increases cortisol, and high cortisol levels break down cartilage and promote joint destruction. Ashwagandha helps regulate the hypothalamic pituitary adrenal (HPA) axis, reducing cortisol levels and therefore minimizing the inflammatory cascade. Several clinical trials have shown that ashwagandha not only reduces joint pain but also improves strength and physical function in people with osteoarthritis. U.S. patients with autoimmune diseases often feel like their body is attacking itself, and in many ways it is. By calming the immune system and lowering stress-induced inflammation, ashwagandha supports better joint resilience and less pain during flare-ups. A high-quality supplement should contain at least 500 milliliters of a standardized extract like KSM-66 or Sensoril, both of which have been used in clinical research. Taken over time, people report not just pain relief but improved energy, better sleep, and a calmer mind, all of which help break the vicious cycle of stress and chronic joint inflammation. It's important to understand that joint pain isn't just about cartilage. It's also about the surrounding muscles, tendons, and ligaments. Magnesium plays a huge role here, and yet over 60% of Americans are magnesium deficient due to poor soil quality and processed diets. Without enough magnesium, the muscles around your joints stay tight, your tendons stay stiff, and your body has trouble relaxing inflamed tissues. Athletes from the United States and Canada often turn to magnesium for recovery, but the general population doesn't realize its impact on joint mobility. Magnesium glycinate or magnesium malate are the best absorbed forms for musculoskeletal health. In the United Kingdom, magnesium is also used to improve sleep in people whose joint pain keeps them up at night. A therapeutic dose is usually 300 to 400 milligrams daily, and for people with restless legs or cramping around the knees or calves, results can often be felt within a few days. Muscle tightness often pulls on joints, worsening pain and alignment. When the muscles relax, joints move more freely, inflammation is reduced, and mobility improves.